Hello, this is Ira Bedzow, and welcome to the Creating Community Through Conversation series that we have, where we're building civil society one conversation at a time. I'm here with Senator Rachel May, who represents the Central New York's 53rd District, which includes most of the city of Syracuse, parts of Onondaga and Oneida counties, and all of Madison County. She chairs the Senate Committee on Aging and the Legislative Commission on Rural Resources. She's also a member of the committees on agriculture, elections, environmental conservation, higher education, and cultural affairs, tourism, parks, and recreation. Senator May has already done a lot of different things in the past 2 years. Before we even start with some of the questions, is it typical to be so active immediately right out of the gate, or how did you get so busy so quickly?
That's a great question. I mean, yes, I think it is typical, honestly. In fact, we actually, at the beginning of my first session in 2019, we reduced the number of committees that most people sit on. So just so you know, cultural affairs, tourism, and parks and recreation is one committee. It sounds like 4, but it's just one committee. So I'm on, I guess, 5 in addition to chairing the aging committee, and that's pretty typical.
No, 5 still sounds like a lot.
Yeah, it is a lot, but honestly, the committees, if anything's been a disappointment to me or sort of anticlimactic in serving in the Senate, it's been the committee thing, because the committees don't really do that much. There's you have a meeting, but the meetings usually last 5 to 10 minutes, and it's just kind of voting up or down whether something should go to the floor. So it's, but the committees do hold hearings, and we've been very active with that. So that's been the one place where they've been a really big deal. But I would say it's the committee that you chair that is really the one that occupies the most of your time.
Yeah, well, you know, it's funny the way you're describing committees. I mean, I'm in academia, you were in academia. I would love to know not only how you got from academia to the Senate, but also, is the culture in the Senate similar to the culture in academia, not only in terms of just committee work, but in terms of how people communicate with each other, the types of expectations people have? What is the similarities or differences between academia and state politics, or state government, I should say?
Right. It's very different. And part of it is, you know, the stakes are high in the state government, and not that they're not in academia, but it's a different kind of stakes that we have. So I would say interactions are much more about how do we get this done more of the time. But the bigger thing for me, because not only was I a college professor, but my father was, and my maternal grandfather was. So I grew up with a culture, the academic culture. And one of the biggest differences for me is that if you're in academia, you're used to basically not opening your mouth until you have read every published work about a particular issue and maybe written one yourself, and you know everything down to the footnotes. And we just don't have that luxury in government. This week alone, I hosted an event about bus rapid transit, and I met with groups that wanted to talk about the HPV vaccine and about landlord eviction tenant eviction issues, and about how to finance the climate bill we passed last year, and problems that arts nonprofits are having. It's just like every half hour you're shifting gears completely and doing something completely new. And you're lucky if you have 15 minutes to prepare for it. So it's a huge cultural shift. It was very hard for me at first. I panicked every time I had to get up at a press conference and speak about some bill that I was co-sponsoring, but I had literally, read the bill twice and talked with one person about it or something like that, and then I was expected to speak in front of the press about it. And that really panicked me. I still try to be prepared, but I have gradually gotten over that sense that I have to be an expert about everything because I can't. One big change from academia, though, is I also have a fairly large staff, and they do a ton of work for me, and they brief me on these things and make sure that I don't go absolutely cold into a meeting and that sort of thing. So that's really helpful, and it's been a little hard to get used to, but it's been great.
Yeah, well, so, it's funny, as you're talking, I'm thinking about academic training, and not even simply just academic training in the humanities and the social sciences, but also in the hard sciences and the professions and so forth. We really have a push towards specialization. While at the same time, when you then go out into politics and government and industry, there's also been a lot of recognition that while specialization and expertise is important, there's the need for generalists and the need for people who can not necessarily read a bill and say, let me wing it, but someone who can understand that being an expert and being able to make many decisions in different areas is a bit of a different skill set. Was that not only a culture shock, but did you see a need in education to recognize that if we're going to be civically engaged, we need to teach differently? Or, how has your experience in government made you reflect on your academic training and education in general?
Well, I'm deeply grateful that I had a liberal arts education as an undergraduate, because I think it's made it's, I have the critical thinking skills, and I know how to ask questions in a wide variety of fields, and that's been really helpful. And I think it's, when I've traveled in other countries, people look at the United States, that's one of our strengths, that we have a kind of general education that enables people to kind of understand a broader range of issues. So I do think we have to keep that up. We can't just get, shift into vocational education or something like that. I think it's really important. I do think in my case, so I started out as a high school math teacher, and then I got a PhD in Russian literature, and I taught Russian language and literature at the college level. And then I got a master's degree in environmental science. And so I think it made it easier for me to run for office, knowing that I had this broad background of my own. And so I felt kind of comfortable asking questions in a lot of areas. And I have to say, one of my favorite things in Albany so far has been the hearings that we hold, because that's your chance to really ask pointed, tough questions and get real answers from experts on things. And I think I've carved out a little bit of a reputation as somebody who asks a lot of questions and really comes prepared and tries to be one of the people who makes those hearings be productive.
I feel like that's a good reputation to have. Someone who comes
happy about that one. Yeah.
I know we talked about it before, but I would love to just hear the story again and talk a little bit more deeply about it in terms of why you decided to run in the first place, if that's okay.
Sure, that's fine. Yeah, I mean, in addition to being an academic, I'm also an introvert, which I think is kind of common in academia, but it is not common in politics. And it wasn't really, I had never thought about running for office. I had worked on a lot of campaigns, and it was always, just to pick up the phone and make the calls or to go door to door or something, I had to steel myself every single time. But honestly, after Donald Trump was elected president, and I felt like a lot of things that I hold dear in this country were under threat, particularly our democracy itself, but also women's reproductive rights and a number of other things. I got, like many people around the country, I got more active in politics, and I was starting from up here, so getting more active meant really getting active. And I started paying attention and thinking, well, why in New York are we not able to have nice things that other blue states have, like a reproductive health act or early voting? And the answer was that there had been a bipartisan Republican lock on the state Senate for almost 80 years. And for a long time, that was the voters' choice, but then it came to be gerrymandering and voter suppression. And then in the last decade, it was some senators who were getting elected as Democrats and then being co-opted in one way or another to help the Republicans stay in power. And my senator was one of those. And I just realized I had supported him in the past, but I couldn't support him anymore. But I felt like we needed to replace him. And I started asking people, you know, would you run against him? Would you run against him? And every time they turned around and said, why don't you do it? And the first 5 times I laughed, but the 6th time I said, okay, I better think about this. And the 10th time I thought, okay, I'm going to try it. And then what I did as a good academic was
You did research?
I got and figured out everything that I didn't know in order to run for office. And I went and I joined Toastmasters so I could be a better public speaker. And I got training in how you run a campaign and how you raise money and a bunch of things like that. And I also found good people to surround me with. But, you know, I dotted all the I's and crossed all the T's before I finally made the decision to run.
Well, let me ask you, when you were looking and trying to figure out not only to run, but, you know, if and when you would win, how you would be a state senator, did you see a big difference between upstate New York culture, priorities, values, interests, and downstate New York? Is there a big difference across the state, or is that more of a perception than an actual reality?
You know, there are differences, but I don't think they're the ones that people focus on. The biggest difference is there are a lot more Republicans upstate than downstate, and it's more of an ideological thing. But in terms of what people need upstate and what people need downstate, it isn't that different. The biggest difference is that we have large rural areas, and rural areas need cell phone service and internet coverage in a way that cities don't, although I represent the urban core of Syracuse as well as an entire rural county. And both of those places have internet connectivity issues that have become massively important, especially during the pandemic. So even there, the differences aren't as great as we think they are. I think in terms of representing upstate, I've worked really hard at it, and I have made sure that my New York City colleagues, so I will say upstate versus downstate isn't that big, but New York City is a world unto itself. And I have brought my New York City colleagues up here to visit farms and to see what a Rust Belt city looks like, and to, you know, visit some of our small businesses and schools and things like that, just to get a sense of what's similar, but also what's different up here. And that's made a big difference. They listen to me when I say, you know, have you thought about this aspect of this housing bill, for example? Like we were doing, there was a giant priority to update our housing laws and improve tenants' rights in the state. And it was long overdue. And we were working on it, and you know, a lot of it had been crafted in the context of rent control that they have in New York City that doesn't necessarily make sense other parts of the city, of the state. And people understood that, but I said, well, what about manufactured homes? In my district, there are mobile home parks where you have people who own the home that they live in, but they don't own the land that's underneath it. And they're facing rent hikes on that land. And it's a sort of a degree of extortion that's even worse than if you just have your rent raised on your apartment. Because if you live in an apartment, it's a hassle to move. It may be, you know, major hassle to move, but you can move. But if you own your house and the rent on the land is changed, a lot of those are not actually mobile. You can't pick that up and move it someplace, and you are either out a house or you're out a lot of rent. And so I got a bill about manufactured homes included in that package of legislation. And I don't think that would have happened if there wasn't an upstate Democrat as part of that coalition kind of advocating for that.
No, of course. If you don't mind, I wouldn't mind talking more about mobile home parks. I used to work in real estate before I went into academia.
Oh.
And I always saw how developers would sometimes look at mobile home parks, not simply for the rent on the land, but as the rent will cover the land lease until they can develop it,
Right.
which then really puts residents in a precarious position. Have you seen that happening in upstate New York? And is that one of the issues that you would try to protect? Because it's much different in a mobile home park than like an apartment building, where they're looking to redevelop an apartment building. It's much more difficult. People understand what that means more than in a mobile home park.
Yeah, I mean, we don't have the big development pressures. That's another difference up here, that, housing values and land values are a lot lower than they are downstate. And it changes a lot of the dynamics in terms of how you fund things, what property taxes are doing up here as opposed to downstate, but also some of those questions about either development or gentrification or those kinds of things. But yeah, there was one just outside my district that it was land that was owned by the Oneida Nation, and they wanted to use it. But they were pretty careful and ethical about it, and they gave people lots of warning, and they offered assistance for people to move and that sort of thing. So, you hope that it's going to happen that way. And I don't think they had necessarily initially started this as an investment where they were going to do that. But I think you're right. There are landlords who.
Yeah, not everyone. I mean, there are great real estate developers who really look to build and grow communities, not necessarily just develop. But you always have to be careful in terms of what types of developers come into a community.
Right.
So if you don't mind switching over, I would love to talk about, just because I'm sure it's on everybody's mind all the time, about healthcare and especially elder care, nursing homes, both during the pandemic, but in general. I know that you've been a very strong advocate to protect both the physical health as well as the psychosocial health of elder communities. But the pandemic also ripped through nursing homes, especially in New York. Would you mind talking a little bit about what's been going on in terms of, are we prepared now for the winter? Have we figured this out? How are we getting ready to protect our vulnerable elder population in New York in the fall? And
yeah, that's a great question. We've been working hard at it. We had hearings in August, and we really grilled the health commissioner and nursing home people who run nursing homes and people who work in nursing homes, like what needs to be done. And we've introduced a bunch of legislation. Right now, what's going on, because the rates of infection with the virus are low, the big issue right now is that it's so hard for family members to come in and visit their loved ones in nursing homes. And what we're seeing is that the virus is much less of a factor than it was, but things like isolation and depression and just cognitive decline are reaching epidemic proportions. And that is, I don't envy the commissioner of health, because he's got to weigh these things. How do you let more people in without also letting the virus in? But what we did was we looked at what other states were doing, and New Jersey and Connecticut and some other states have put in place a policy where you can designate, a resident of a nursing home can designate an essential caregiver from the family who would be able to visit, get entry just the same way that the staff do to the nursing home. So subject to the same testing and PPE protocols. And there's several reasons why that's important. And I think that would be important even if we saw an increase in the virus as well, because those people are there being eyes and ears to see if somebody is declining, to see if there's abuse going on, to make sure that there isn't some other problem. Like, well, I've heard from family members of people who died because they were in a nursing home just for rehab after surgery, and then they got an infection and nobody noticed because the staff were so overtaxed at that point that they weren't paying attention. And the person died of an infection. It wasn't COVID, but COVID, had upended the way things were working in the nursing home. So if the daughter could have gone in even once a week, that might have been caught. So I think it's a health issue, making sure that there are people who can be eyes and ears in there is really important. And are we prepared for another surge? I mean, I think we know a lot better about things like infection control and how to, I think, a lot of the things that the governor was able to do can be done again to bring the rates down a lot faster than they came down the last time.
Yeah,
and we understand the virus more too. So I think, I don't want to say we have everything right, but I think we're in a better position.
Yeah, no, I can imagine. I mean, I can imagine also at the state level, but it's similar to the organization level as well. That, like, the questions you ask are not simply, do we let family members in, or do we do this? It's more, how do we ensure that the residents are protected while at the same time receive and have the opportunity to have the family and social and other needs, that those are met as well. It becomes a how question as opposed to a whether question, which allows you to maximize your goals and be protective and aware of what the pitfalls might be.
Yeah. So one of the big things that I'm working on, that I worked on before the pandemic happened, this was a big focus for me as chair of the aging committee, was the healthcare workforce. Something that is near and dear to you as well. Right. But we just don't have enough people to staff the nursing homes or the home care. If people don't want to be in nursing homes, we don't have enough home care staff. And it's worse upstate than downstate, but it's true all across the state. And a large part of that is because we don't pay people enough. And we don't offer things like career advancement for people who do home care. There are a number of reasons why people aren't going into this field. And one of the vectors, apparently, the main vectors for the disease in nursing homes in the spring was the fact that there were people who worked in the nursing homes who couldn't make a living at it. And so they were working 2 jobs, and they would go from one nursing home to another nursing home and do a second shift. And so they were bringing, even if it was only in one nursing home, then suddenly it was in a lot of nursing homes because people were crossing over between them. And I'm trying to figure out, and I've been talking with people from 1199, the union of most of the upstate healthcare workers, and people from nursing homes, and at the state level, are there things we can do? Can we insist that a nursing home pay overtime? If somebody needs a second shift, have them do the second shift in that nursing home, not in a different one, or how do you get at this issue? And it is extremely expensive, and it is very hard to solve this problem. And we were far from solving it before the pandemic hit, and we're much farther from a solution now because the economy is that much harder, and the needs are that much greater.
I was in a discussion with a health leader, not in New York, in Colorado, but in a very similar topic came up, where how do you develop and make sure that you have a robust healthcare staff And they found that it was not only necessarily an economic issue, although it very much was, but it was also a cultural issue. And this is the example that she gave. She said her hospital is very careful to do professional development for the majority of the hospital staff, from doctors to administrators to nurses and so forth. But they realized that the one group that they consistently just assumed would always stay where they were and didn't need professional development was janitorial and kitchen staff. To which this leader then said, why would that be the case? Why are we making an assumption that they want to stay a janitor their entire life? Why not provide professional development that might also allow not only more retention, but better staff at the same time, more satisfied staff, people who won't leave, and so forth. So she really invested in making sure that the entire health community that was under her charge felt valued and professionally developed. But you can see the same thing in health staff in many different states and in many different areas, in terms of if you just take health care workers for granted, not only will they suffer from burnout, but they'll also not do their job as well because either underappreciation or overtaxed or overworked and so forth.
Right.
There
was a really interesting study done in the Hudson Valley that was came out a couple months ago, and they interviewed lots of home care workers who are, sort of at the nurse's aide level, CNA level usually, if that. And what they found was people had a lot of job satisfaction. They liked the job, but they couldn't make enough money at it. They couldn't justify it. And they were often traveling long distances to get to wherever, or, having to stay overnight. They were, it made it impossible to be with your family. It was just really hard. And this was, had nothing to do with COVID. This was just in general. We have to pay people better. And one of my hopes is that now we recognize these are essential workers. Now that we have that phrase, essential workers, that we will, I hope, continue to understand, even when there's not a pandemic, that time comes, that they're still essential workers and still deserve to be remunerated accordingly.
Yeah, so I definitely agree that there's been a really big perspectival shift in terms of who we take for granted and who we appreciate. I also know that you've been a really strong advocate to change healthcare in New York and been working for the New York Health Act. Do you think now's the time, like there's more willingness to entertain the idea of changing New York healthcare delivery, or are there still major obstacles financially, economically, socially, culturally? Where do you see healthcare going in the next 2 years? And do you think it depends on what happens federally? Like, is New York State, can New York State actually move without a move in the national government?
I mean, for me, that's the biggest question. I feel like it's pretty obvious that we're better off doing it at a national level than at a state level. But if the federal government doesn't look like it's going to move, I think the state has to. And the reason is because you can't have a situation where people are losing their jobs in droves, like was happening in April and May, and they're losing their health insurance at the same time. And especially when you're in the middle of a public health emergency. That's just the mark of an immoral system of healthcare. It's just wrong. And I think a lot more people in America saw that and recognized that than have in the past. I think, the concept of healthcare for all, or even single payer healthcare, has been way more popular than we think it is based on the public discourse about it. But I think it's through the roof now in terms of the support for it. We held a hearing must have been February, about the New York Health Act. That was a very powerful event, and it was separate from the pandemic, just talking about the reasons for it. And the testimony was so powerful that there were literally people. There was one guy who was there to testify on behalf of his organization that had a very strong stance against the New York Health Act. And his job was to get up there and testify against the New York Health Act. But he sat through this testimony from, a father whose son had died because he couldn't get his antidepressant medication because he had missed a $20 insurance payment and he ended up committing suicide. There were just awful stories. And then there were really positive stories from business owners who had employees who worked in Canada and the Netherlands as well as in the United States, and talked about how much easier it was and how much more satisfied those employees were with their health insurance, and from an administrative standpoint, how much less time it took for them to do all the work of getting health insurance for their employees. And, there was a lot of really strong testimony. And this guy who was supposed to testify against it and did, he started off by saying, "I wish my entire membership had been here." And he couldn't say, because I would say the opposite of what I'm about to say, but that was clearly what he meant. He was convinced just by sitting there for 2 hours and listening to people tell these stories.
I mean,
so,
as for someone who studied Russian literature for so many years, the power of a story goes so much further than figures and statistics, because at the end of the day, while it's important to have a strong empirical foundation, if you don't tie your argument to people's lives and the ability for someone to look at another person's face, you're not going to be persuasive in the same way.
Yeah.
Yeah. I want to ask, because I had this thought the other day, and I think it applies more to the federal level than the state level, just given the way things work. But let me put it out there, and you tell me what you think. So, for years, whenever we talk about healthcare, we always turn the discussion into economics and how do we pay for it. But after the pandemic, and we've seen how much money the federal government is willing to put out to save people, save small businesses, save larger businesses, save people who aren't employed and so forth, it's hard to say that there's just no money for it anymore. It's easier just to say and be honest and say, we don't want to put the money there. We have other priorities that we care for more. I mean, that may sound bad, but let's be honest. Like, if you can have bills that are trillions of dollars, then you can't then say, "Oh, well, we ran out of money," But I think that only really works on the federal level. I don't know if the state has that same ability to say, "This isn't actually a money issue. This is a priority and choice issue."
Right. I think you're right, but I also think the fact that we did that, so it doesn't happen that often that the federal government looks in that kind of global way and says, we've got to fix all of these problems all at the same time, and it's going to require this kind of outlay. And you do it on the premise that it needs to be done, but also that in the long run, this is cheaper than just letting all of these wounds fester, right? Than letting, millions of people die, or letting every business eventually go out of business, or, there's a long-term calculation that you're making there. And with healthcare, we have been accepting for a very long time of doing it piecemeal and letting the healthcare decisions be made at that individual level with the healthcare insurer, or at the employer level with the insurer. And if you do it that way, globally, it is way more expensive. And this is the argument of single payer, that if you stop farming it out to all these little private concerns that are going to be trying to make their own profits, but also just, are making decisions independently of others, when the decisions, if they were made collectively, could be far more efficient on things like drug prices or preventive care. If that, maybe the fact that we were able to do that as a nation for, you know, some of the pandemic relief that happened, maybe we'll be more inclined to understand that this is, you know, you have to take that global look at it and say, oh, the way we're doing this is ridiculous. And it's not serving people's health, and it is not economically viable if you actually take that, you know, 10,000 foot view of it.
Well, so let me ask you, but do you think that here it's just an example of misaligned interests? And what I mean by that is healthcare is really a long-term plan. Like if you're going to change healthcare globally, the benefits that you will see from that change are not going to happen immediately. But when you're running for office, you're running on a 2-year, you know, maybe 4, maybe 6, I mean, depending on what office you're running for, but, you know, a very short, yeah, well, it's a short term. Like if you say, oh, I did such great things, you'll see benefits in 25 years from now. That's a hard sell.
Oh yeah, that's true of so many things. That's why, you know, we've never been able to do real serious work on climate change, but, you know, for the same reason. We don't have a government that's well suited to do long-term planning. But I think actually with something like the New York Health Act, you would see immediate benefits. Maybe not the economic benefits so much at the, you know, to the society, but certainly to individuals, you'd see a lot of benefit.
Yeah, we would just have to make sure that our society cares about those benefits, and we don't judge our success simply by market terms, but by civil terms. You know?
Right, but you know, I met with medical students at SUNY Upstate last year, and they were so excited about the New York Health Act. And I mean, I imagine that an awful lot of people go into medicine wanting to practice medicine and do good for people, and not to, you know, process lots of paperwork for insurance companies. Like, I think if you can shift to a system that's more about that direct relationship, I think you can make a lot of people's lives better pretty quickly.
No, I agree. And yes, that's a very, it's the type of aspiration that medical students have, and real professional physicians and healthcare workers continue to have, even as they develop and gain experience in healthcare.
Right.
Do you mind if we move to environmental issues? Because you know, you mentioned environmental issues being, or the government being ill-suited to dealing with climate change. If we recognize that, then how do we become more effective? Do we try to look for economic incentives, market incentives, privatization incentives? Like how do we do this in such a way that makes people recognize that what they're spending, or the costs of their continued actions, are going to be paid for not by them, but by future generations? Well, truth be told, at this point, it might be them, like depending on how rapid the change is. Yeah.
Right. I mean, well, we haven't done it. We did pass a pretty good climate bill last year, the Climate Leadership and Community Protection Act, which is the strongest one of any state in the country. And I'm very proud to have been part of putting it together, but it did not include a financing mechanism to, you know, make it sustainable, and we still have to figure that part out. And it also, you know, it set targets of 2045, that kind of thing, and I don't honestly think we have that much time. My sister-in-law lives in Talent, Oregon, and her house is still standing, but 2/3 of her town is gone.
Yeah, no, when you said that, my heart actually skipped a beat for a sec. Yeah.
And, you know, any given forest fire, the causes are, you can't really identify, but this is very clearly climate change. What's burning the west coast of the United States? We've had a long-term shift toward hotter weather, drier weather, stronger winds, and there's very little that can be done about it. That is the new reality out there. So we don't have a lot of time to dither around about how we're going to make this happen. And the encouraging thing is that young people totally understand this and are putting the pressure on a daily basis. And I am hearing from them constantly about, the changes that we have to make. And there are changes that 10 or 20 or 30 years ago, people in the political sphere barely dared to talk about. But now we all get it. We've got to shift away from the internal combustion engine, and we've got to weatherize every home. And there are so many things that we have to do that are different, that I think that the positive shift, the biggest positive shift, is that people recognize that they aren't necessarily things that reduce our quality of life. That was what was sold to us for a long time. If you remember,
No, I do.
Ronald Reagan saying, environmentalism just makes you colder in the winter and hotter in the summer, something like that. And
it was that, and the line of, I'm not a scientist, but although we still have that line, we still
have that line.
Yeah. Well, so
I feel like I've wandered. I'm not sure I'm answering your question.
No. So in terms of practicality, so I'm going to ask this question. It's going to be a little bit roundabout. So like, for example, in California now, they're pushing by, what is it, either 2030 or 2050, something like that, no new gas vehicles. Cars have to become electric. And you can already start imagining, well, if such a populated state like California is going to be pushing that, then the car industry is not going to say, well, I'm going to have a California market and a national market. That gets very difficult. How many different types of cars am I going to be producing? So as California goes, so goes the country, just by virtue of its population.
That's what happened with fuel efficiency standards.
Right. So does New York have that same power to be able to do similar things as well, or do we just have to rely on California every time?
Well, New York's a big market, and the biggest one in the Northeast, so that gives it a lot of power. California had all the smog issues, and they started emissions testing and emissions limits on cars a really long time ago. And things like, that you could turn right on red, that was a smog reduction program, basically, that then became, it was like, oh yeah, this makes sense. We do it all around the country. So California is big enough, and its issues are stark enough that they're able to do this, I think, faster usually than New York does. But New York has a lot of influence too.
Yeah, no, I can imagine.
And we're part of the regional greenhouse gas initiative, so we work with 7 or 8 other states, and once you put them together, that's almost as much as California too.
Well, so I was actually going to ask about that, because I mean, I'm sure we're all aware that climate doesn't really respect state boundaries. So how do the different states, or how does the region work together in terms of regulating or self-managing, if you will? Right.
It's what do you call it? Not exactly a carbon fee, but cap and trade kind of thing. And it raises quite a bit of money and then is used for different initiatives around the region to further reduce greenhouse gas emissions. So, rebates for electric vehicles or that kind of thing. One of the things that we're grappling with, and that I tried really hard in the climate bill to make sure that we were codifying is we have to get away from what's happened over time with alternative energy projects, is that they have tended to be kind of boutique projects where you give a rebate for putting solar panels on your house, but there's like a $20,000 or $25,000 upfront cost to doing that. And so only certain people can do that. You've got to be pretty affluent to do that. And you've got to have a big enough roof in the right place to do that. And so a lot of the subsidies, for electric cars, all these things have gone to relatively affluent people and affluent communities. And the people who are the most impacted by climate change are, as usual, being left out of that equation because they can't afford to participate in these kinds of, to put a geothermal system in their house or something like that. So the bill very explicitly charges the Climate Action Council to make sure that environmental justice and climate justice are at the table, being considered in every decision they make. So that when there are outlays, they are the first things you do are things like weatherizing homes of low-income homeowners and renters, rather than subsidizing these boutique projects.
Yeah, no, 100%. I mean, you have to recognize that, you need the right solution for the right problem, and you need to have the right peg in the right hole, meaning like things that are public goods need public solutions, like clean air and clean water, where everyone benefits and you're not going to run out of it if you do it right. Recognize that it's a public good and needs public answers. Common goods, where everyone benefits, but there's still limited supply. You may see it publicly, you may see it privately, but if you see it privately, you have to recognize the public responsibility and regulate that properly.
Right.
Don't take common and public goods and say, oh, well, we can use like individual or private type of mechanisms, because you're missing where the benefits are lying by doing it that way.
Yeah. I have to say it's been one of the great pleasures of serving in this New York State Senate, because my colleagues in the Democratic majority that I'm part of are really attuned to this kind of issue. So, for example, legalizing marijuana is a big issue in New York, and we want to get there. But the reason we haven't gotten there yet is that we haven't come up with a mechanism where we can make sure that this isn't just going to be a boondoggle for big corporations that will come in and make a ton of money, but rather we want to make sure that the benefits are going to people who, communities of color that were victimized by the drug war, for example, and people who have paid a lot of price for the criminalization of recreational drugs in the past, and that's hard to do. And I love that my conference is working so hard to do the hard things and get them right, rather than just, the flashy things.
Well, since you brought it up, I would love to actually talk about this a little bit in terms of legalization of marijuana, because in one respect, I understand some of the benefits of legalizing marijuana. I also understand that there are certain consequences that you have to be careful about in terms of making sure that there's proper mental health resources, that there's proper social and health networks, that recreational use of marijuana doesn't turn into recreational use of other drugs. How do you, as a state, balance these benefits and detriments, seeing where things could go, both for the good and the harm? How do you discuss that in the Senate?
So we haven't really had this conversation yet, so I can't answer that so much, but I do know, there are a lot of specific policy issues about, how you measure impairment with driving, for example. And some of those issues. And honestly, at the policy level, you're always weighing the pros and the cons. And right now, what we have is a situation where New Yorkers in very large numbers are going to Massachusetts and New Jersey and Vermont and buying their marijuana there and bring it back to the state. And so doing nothing is not really an option. And so the idea is, how you do the best you can, while recognizing that this is already happening. And in fact, what I've heard is New York, even with it not being legal, is the largest market for marijuana in the entire Northeast. And so illegally it's here, or extra legally it's here now, so it's a matter of coming up with the parameters. I don't think we're going to get to a point where we're investing a whole lot more money in mental health care because of this. But that is definitely on the table for a lot of other reasons right now. But I think that probably isn't going to be a component of the marijuana legislation.
Right. Well, we don't have to talk so much more about marijuana. I'm sure as the conversations in the Senate continue, we will have another conversation about some of the details. Yeah. For me, it's actually a really fascinating test case on a few things. One, in terms of how do you balance the benefits and detriments? Two, how do you look at it in terms of, well, if people are already consuming marijuana, do we legalize it because it's here already? Or do we try to understand why people are using marijuana more and more to see if the issues are simply recreational, self-medication, and so forth? And is there a root cause analysis that should be done that we're just not doing because we're just accepting? And what that means. So in general, and it doesn't even have to be with marijuana, any type of social phenomenon you can look at as, does the fact that it exists means we should accept it, or does the fact that it exists means we should question why it exists?
Right.
Yeah. So we don't have a lot of time. I was going to ask you either, and you have a choice now. We can go either way. We can either talk about your desire to change campaign finance reform and some of the stuff you're looking in terms of democracy reform. I know we spoke about a bill that you wanted to pass in terms of looking at the consequences of bills as opposed to just relying on lobby groups. Or we could talk about if there is a change in the U.S. Supreme Court, will that actually affect New York? Or is that an issue that it may affect the country, but it won't affect New York as much as media or we might think it might. So which one would you rather go? Which route would you rather go down? Judiciary or?
Let's talk about the democracy issue, because that is also on the front of a lot of people's minds right now. And there's a lot to say about what we did. I mean, it was, although, reproductive health and democracy reform are probably my two number one reasons for running, or my 1 and 2 reasons for running. But democracy reform, we've done a lot. New York had some of the worst voting laws in the country until 2 years ago. And that wasn't an accident. That was because the people controlling the New York State Senate wanted to make sure that as few people would vote as possible so they could maintain control. And as soon as we shifted the control, we passed early voting, which 42 other states or something like that already had, but New York just wasn't allowed to do stuff like that. We have passed automatic voter registration. It won't take effect for a little while, but that means, as soon as you get your driver's license, you're automatically registered to vote unless you say you do not want to be.
It's like an opt-out versus an opt-in.
Right, which in all the states that have it, it results in much higher rates of registration.
It always does, because the status quo, people stick with status quo. It's harder to make a change than it is to say, okay, whatever, if you're making it for me, then that's fine.
the Board of Elections here in Onondaga County is working overtime right now because so many people want to register to vote all of a sudden, because October 9th is the deadline if you want to vote in the this upcoming election. But that's ridiculous that we have those kinds of barriers, you know, and people, especially because people often don't start paying attention to elections until the last few weeks. And if you have already set it so you can't register to vote in that time period when you're most likely to be interested, then you're freezing out a lot of people. So automatic voter registration is a big deal. Same day voter registration, so that you could register on the day of the election. That's another big deal. And vote by mail, just universal vote by mail like they do in Oregon and I think Utah and a number of other states, is the best way to get a real outcome that expresses the will of the people, where you get the most voter participation.
Would it be crazy to eventually conceive of voting online? Would that even be possible? Because I mean, I know we're talking about vote by mail, but I also know that like the amount of mail, like the younger you are, the less you send letters, let alone know even what a post office is.
Oh yeah. When my daughter went off to college and I was running for office and I said, I want you to vote in this election, you have to vote absentee. She was like, well, I don't know. How do I get a stamp? I will send you a stamped envelope. So yeah, but
yeah, sorry for interrupting.
The thing you want is a paper trail in elections. We don't want to turn it over to the electronic world for the reasons that we've seen of you know, tampering and hacking, that kind of thing.
Right.
So voting online, I'm sure it's possible to do, and I'm sure it's done in some places, but it's a dangerous thing to do. You have to really be careful about it. Mm-hmm. But you know, this year is testing us in many, many ways, and this administration is testing us in even more ways, every way it can think of, including trying to destroy the postal service. But honestly, the election laws are a lot better in New York than they were, and I'm very proud of that. And we even are going to have public financing of state level campaigns in a few years. So yeah, which will make a big difference. I mean, I spend, you know, an embarrassing amount of time on the phone calling total strangers and asking them for money. And it's not a good use of my time. It's not,
I mean,
serving my constituents in any way. And, you know, if I wasn't me, sometimes it's undermining the values of your constituents in the way some people do their fundraising, you know. So it's crazy that we do it this way. So that's a big deal that we're shifting that. New York City already does it, and it's basically going to be at the state level that, you know, for state legislature and governor, lieutenant governor, attorney general, those races will be covered by the same kind of laws.
No, that's great. It opens up the field for people who didn't think they'd be able to run by virtue of their own finances and personal risk, and allows them to potentially have a voice where they didn't think they would be able to exercise that.
Right, and they get a lot more people running for office in New York City, which is good for our democracy. It makes it harder to, you know, run a campaign, but it's really good for our democracy. And people, like you said, people who never thought they could, who haven't got a, you know, a contact list of people with money, which is, you know, a stupid way to be choosing our elected representatives.
So we got time for one question left, but I mean, this is always a question I love to hear what people have to say. What are you excited about in the upcoming year? Like, what do you personally, in addition to your representative, who you represent and so forth, but like what gets you excited about what you're going to work on next year in terms of what you're looking to accomplish?
Yeah, it's a hard question because we face such a...
There's a lot to be excited about, but...
There is. I mean, the budget issues are going to be huge. And I guess, you know, my excitement is premised on the idea that we're going to have a different government at the federal level, so that we're going to have partners there who want to bail New York State out of some of its financial woes. But if we can do that, I think I'm really excited about shifting or working towards shifting the way we finance our government. And I mean that in the largest sense, like I've got a bill to raise marginal tax rates on people who make 5 or 10 or $100 million a year, because I think we've gotten way out of whack in terms of who is financing our government. But the property tax system that we use is incredibly inequitable, especially for funding our schools. And so I'd say in my conference, there was a very, very strong desire to change the way we fund our schools in New York State. And I think that's going to be a big fight, but it's also going to be an important fight, and one that I'm excited to be part of.
I look forward to having another conversation with you in a few months and hearing how, I mean, there's a lot of things that I want to hear about, but hearing how that fight goes.
Okay.
There is nothing more important than recognizing how you invest in your future leaders. And if you don't have the money to invest in them, you're going to get what you pay for.
Right.
Yeah. So, well, look, Senator May, I truly appreciate the time. This has been
really fun, Ira. I love this. And I hope you'll send the link where we can watch this.
Of course I will. And we will definitely speak again soon.
Thank you so much.
All right, thanks. See ya.